सर तुम्ही नाही जॉईन झाले अजून.
हॅलो सर, वेटिंग रूम मध्ये जे स्टुडंट्स आहेत त्यांना ऍडमिट करायचं आहे का?
येस सर. हो सर.
ओके. आणि सर ओके, तुम्ही स्पीकर यूज करताय की माइक हेडफोन यूज करताय?
माईक आहे सर. स्पीकर आहे आमच्याकडे.
ओके, कारण मला माझा आवाज
सर तुमचा आवाज जरा द्या. हॅलो.
हा येस सर.
येतोय आवाज सर तुमचा.
No, my voice is clear, but I'm getting repetition. I can hear my voice twice. Okay. Now it is fine.
Students ऍडमिट करून घेतले. माईक म्यूट करा सर.
Good morning to everyone. Good morning. Good morning to everyone. Honorable Principal Sir and our today's speaker, Dr. Bharat Doksawe Sir. Respected faculty members and participants. Myself, Ms. Meena Zinamdar, Assistant Professor of Samartha College of Pharmacy, Bellew. Heartily welcome to today's webinar, Anticancer Agent. This webinar is organized to provide in-depth detail about anti-cancer agent for pharmacy student and also part of a D-Pharm and B-Pharm syllabus. As we all know, in a present condition, number of patients suffering from a cancer, not only in India but also all over the world. According to the National Cancer Registry Program of Indian Council of Medicinal Research, more than 1,300 Indians die every day due to the cancer. Now I would like to introduce today's honorable speaker, Dr. Bharat Doksawe Sir. Sir currently working as a Associate Professor and Head of a Department in Pharmaceutical Chemistry at S.T. Johan Institute of Pharmacy and Research, Palghar. Sir has completed his M Pharmacy from Government College of Pharmacy, Karad in 2007 and PhD from JNTU, Hyderabad in 2016. Sir has a qualified GATE in 2004 with All India rank 113. He has a total 14-year teaching experience and currently he is an MBA coordinator for S.T. Johan Institute of Pharmacy and Research. He also has a presented paper in several international conferences and has a total 19 publications to his credit in international and national journals. He has a guided for M Pharmacy student in M Pharm Quality Assurance. His teaching interests are organic chemistry, medicinal chemistry, advanced medicinal chemistry, and quality management system. Without taking more time, now I would like to request the Honorable Speaker, Sir, kindly start with the session. Thank you, sir.
Okay, thank you, ma'am, for the introduction. I would like to just confirm one thing. There are around 45 participants, so should we go ahead?
Yes, sir.
Okay. Good morning, everybody. And at the outset, I would like to thank management and principal, Sir Dr. Santosh Bhule, sir, for providing me this opportunity to elaborate or guide you on the topic of anti-cancer agent. As per the discussion with sir, this topic is, I think, included in the PCI syllabus in semester 5. As far as syllabus, this topic is concerned, anti-cancer agent. Just now, as the Minaz ma'am explained, it is not only the concern in the Western world now. Actually, before some years, cancer was just the disorder of the Western world. But now, currently, the disorder has entered the developing countries also. Currently, initially it was considered that cancer is a disease of only the Western world. Okay, but this disease is now has entered the developing countries also, and there is a rapid need for development of newer drugs. There are maybe 10-15 years back, all of you must be aware that there were very rare cancer patients. Okay, but nowadays we see very obviously the cancer patients around us, and there is a lot of need for development of anti-cancer drugs. So regarding this webinar now, first of all, I hope all the students and faculty of the institute are safe and doing well during this pandemic time. And it is very good thing that the institute has organized such webinars for the development of faculty and students. So I heartily thank faculty and management and the principal of Samartha Institute and Samartha College of Pharmacy. So without taking more time now, I will begin with the topic. Now, this topic, anti-cancer agents, actually, if you look at the PCI syllabus, it is included in semester 5. And as far as my information is considered, there are semester 4 and semester 5, both the students who are attending this webinar. So I would like to inform you that semester 4 and 5 students who are studying medicinal chemistry already, when you study any topic in the medicinal chemistry, it is considered that there are 3 or 4 objectives, and these objectives I have taken from the syllabus only. Whenever you study medicinal chemistry, you should understand the chemistry of the drug, okay, with respect to their pharmacological activity. Means I can understand it is very difficult to draw any structure of the drug, because if you consider total number of drugs that are to be studied in this, it is vast. Okay, they are huge. So it is very difficult to remember all the structures, but at least you should be able to identify the drug from the structure. Second thing is understanding the drug metabolic pathways. See, any drug which enters the body is bound to get metabolized. So you should know whenever drug goes inside the body, what are the possible metabolic pathways. Okay, then you should know the structure activity relationship of the different classes of drug. So what is structure activity relationship? The any change you make in the structure of drug, how it is going to affect its activity or toxicity. That is all studied in structure activity relationship. And finally, the synthesis of drug, that means how that drug is manufactured. So I'm hoping that at the end of this session, all of you, these objectives are covered and students get at least an insight of the anti-cancer agent. One more thing I would like to announce is, if any student or any faculty would like to ask anything in between, they are welcome. You can just unmute yourself and you can ask any question in between, or you can ask the question at the end of session. Okay. So what you may have in your first year and second year, you may have studied pathophysiology or physiology, in which you must have seen what is cancer, what is the reason for cancer, and all those things. Maybe in briefly we'll revise those things. Now, anti-cancer agents are also called as anti-neoplastic agents, right? And reason for that is what? Neoplasm. What do you mean by neoplasm actually? Neo is new and plasm is actually new cell growth. So any additional or new cell growth is considered as neoplasm or cancer. Now, actually cancer is not a single disease. It is a group of disease which is characterized by uncontrolled growth of cell. Now, see, normally you may have observed that there is additional growth in body, which is of different types. Sometimes it is harmful, sometimes it is not harmful. For example, you may have seen moles, warts. Okay, you may have seen there are so many people who have some additional, see, like pimple-like thing which grows on the skin in the neck region or in the back on the back. There are different types in that. Okay, so these are moles, warts. Okay, normally they are not harmful to the body. So what is done? They are not treated. They may be treated for cosmetic reason. Means if person wants to look nice, that those things may be removed with surgery or medicine, right? But those are not harmful things. So actually all those things are what? They are benign tumors. Means they are additional growth of the cell, but they are not harmful to body. So they don't need treatment as they don't harm body, right? So the two types are actually benign tumor and malignant tumor. Okay, so we'll see what exactly the difference is between benign tumor and malignant tumor as we go ahead through this presentation. Now, normally, as you see, in our body there are healthy cells. I will give you example. If there is any problem with the audio or video, kindly let me know. Minaz ma'am, I hope if there is any problem with audio or video, you will let me know, right? Hello, Minaz ma'am, am I audible clearly?
Yes, sir. Yes, sir.
Okay, okay. So, see, normal cells which are present in our body, they are strict under biochemical control. I will give an example. All of you know there is RBC in the blood, right? That is erythrocytes. So, whatever blood cells are present in the body, they are formed in bone marrow. Now, in our body, there is continuous production of blood cells or RBC in the bone marrow, right? Now, normal lifespan of these RBCs is 120 days. What does it mean? When RBC take a birth, it will be alive for 120 days, and after 120 days, it is supposed to die. So, what is that death? That death is considered as natural death, right? Now, this death of an RBC is because any body cell is under biochemical control. What do you mean by biochemical control? There are signals or enzymes in body which are responsible for growth of any cell, and it is also responsible for death of that cell. That means it is not possible. See, it's like a human being takes a birth, and at the age of 60, 70, there is aging, right? So after a certain age, person will die a natural death. Okay, so that is called apoptosis. Okay, the term for the cell natural death is called as apoptosis. Whereas any healthy cell, its growth is controlled. That means now even in human beings, see the growth is controlled. After certain age, the kid will speak. After certain age, it will walk. So this is under the control of biochemical control of the body. So in the same way, growth of a cell like RBC is also under the control of biochemical control of body, and that is called what? Senescence. So control on the cell growth is called senescence, and natural death of a cell is called apoptosis, right? Now, if any person dies at the age of 30 because of some accident, right? So that will be called what? An accidental death. In the same way, if RBC, there is some infection or inflammation in the body, that RBC will die and it will not be a natural death, right? It is not an apoptosis. It is what? It is necrosis. So that is difference between apoptosis and necrosis. If it is a natural death of cell, it is called apoptosis. And if it is an accidental death or death because of injury of the cell, it is called necrosis. So that is how normal growth of, so as I told you, an RBC after it is produced in bone marrow can live up to 120 days, or for 120 days it will perform its function. After 120 days, what happens? RBC will die and another RBC will be produced. So normal RBC count in the body will always be remain constant and it will be under some limit. Now suppose this growth of RBC or multiplication of RBC is not under the control. What will happen? More number of RBCs will be produced than required. Okay, and that is what results in cancer. Okay, so that is how cancer cells are produced. Normal regulatory mechanism which controls the cell growth and multiplication, it is lost. Okay, now we'll go to the next point, that is what are causes of cancer. See, normally, as I told in the earlier discussion, initially the cancer was actually the disease of Western world. The countries like America, Europe, they were having more number of cancer cases. And reason for that was what? Cancer was associated with the industrialization or revolutionary growth. So because there was more industries, there was more pollution, and there was more toxic chemicals which were responsible for cancer. But currently there are so many cases of cancers in the developing countries like India, Pakistan, or you can say in the continents like Asia and Africa too. Okay, because so these are the causes of cancer. The first and most important cause is environmental factors like cigarette smoke, chemicals, pollutants, UV light, and viruses. Another reason is inherited metabolic processes which produce free radical in body and DNA copying and DNA repair effect. And third one is inherited genetic mutation. So sometimes there is mutation inside the body because of production of some chemicals. Okay. So these are reasons for cancer. So there are viruses which can produce cancer. There are chemicals which can produce cancer. Okay. These are the two common reasons. So now we will look at what are cancer cell properties. That means how, see, I told you normal RBC after taking birth, it will grow for around 120 days and then it will die. But when it becomes cancerous cell, the properties of normal cell and cancer cell will be different. See, all of you must have heard the term chemotherapeutic agents. Normally we call the chemotherapeutic agents to what? The drugs which are used to treat a foreign infection in body, right? So antibacterial compounds, antiviral compounds, antifungal compounds, all these compounds are considered as chemotherapeutic agent because they don't kill body cell, right? They kill the bacteria or viruses which has come from outside, and they are called as xenobiotics. So xenobiotics are what? Anything which is foreign to body, anything which has come into body from outside is called xenobiotic. Now a cancer cell actually is not a xenobiotic, right? Why? Because cancer cell normally or initially was a part of body cell only. It was a part of body only because it is not following the signals of body, or it is there is an extra growth. It is now, you can say, it is not a normal body part now. It is an additional body part. Okay. So, but anti-cancer compounds are also considered as chemotherapeutic agents, right? So what are the cancer cell properties? How the cancer cell is different than the normal cell? Uncontrolled proliferation. That means they grow and multiply uncontrollably. It is not under the control of body, right? So they keep on growing, and there is no control of body. That is difference between normal cell and cancer cell. Now, dedifferentiation or loss of function. What does it mean? I gave you example of RBC. See, normal RBC, what is its function? It carries oxygen or it carries hemoglobin, right? But now this, if RBC becomes cancerous or if there is a blood cancer, what happens? It does not, it no longer is able to perform its function. Its normal function is to carry the blood or carry the oxygen, right? It is no longer able to carry the oxygen. So that is the second property, that is dedifferentiation or loss of function. The third one is invasiveness or metastasis. Invasiveness and metastasis is similar. What is metastasis? See, metastasis is actually what differentiates between benign tumor and malignant tumor. I told you what is example of benign tumor, the mole or wart which is present on the body, right? You can see there are moles or warts which grows on the body. Okay, these are not metastatic. They don't migrate from one place to another place, right? So that is how they are developing the secondary tumor. That means if there is cancer in one part of body, the cell from that part will go and travel to other part of body, and it will develop cancer to that part of body also. That is called metastasis, and that is the property of malignant tumor, and that is why malignant tumors are harmful and they require a treatment. Okay, now we'll go to cancer types. Already we have discussed benign tumor and malignant tumor. These are two main types, and they are classified based on whether they are harmful or not, right? Now, different terminologies in cancer. Now you see, you may have heard different types of names of cancer, and the names are given based on which type of tissues are involved, right? So this here is the list of, you can see on the screen, different types of tissues and their names. So if it is blood cancer, it is called, if it is blood cancer, it is called leukemia. If it is lymphatic tissue, it is called lymphoma. If it is embryonic tissue, it is called blastoma. If it is epithelial tissue, it is called carcinoma. So this nomenclature is given to the cancer based on the type of tissues involved in cancer. Okay, now we'll go to the cancer treatment history. Okay, now if you look at the history of the cancer treatment, there was no treatment available before 1940 actually. Okay, 1940 is a time of World War. Okay, so in 1955 and 1960s, and at the same time 1965, this treatment came out. Okay, so there are basically three types of treatment which are available for treatment of cancer. One is surgery, in which cancer is directly removed, but that can be done only when the cancer is solid mass or tumor, right? Then second part of treatment is radiotherapy. You can use radiation to kill the cancer cell. And third one is chemotherapy. That is use of drugs or chemical agents to kill the cancer cell. Now, after 1990, there are so many innovations or growth in the cancer therapy. So these are immunotherapy, hormone therapy, stem cell therapy, gene therapy, growth factor therapy, specific signal pathways, monoclonal antibodies. Okay. So these all are recent advances in the treatment of cancer. In this lecture, we are going to focus on chemotherapy, which is given in detail in your syllabus. Okay. Now, as we all know, there is vast or very fast growth in the antibacterial therapy, right? But there is not a fast growth in cancer chemotherapy. What I mean to say is, you see, in 1941, antibiotics were discovered by Alexander Fleming. Now, that is considered as a discovery of century, right? That particular discovery was awarded Nobel Prize, and that is very, very important discovery. You know, all of you know what is the importance of antibiotics nowadays. They are part of very much part of daily clinical therapies. They are used very widely, antibiotics. And reason for that is what? Antibiotics are developed at a very faster rate. But at the same time, you see cancer drugs are not coming at the same rate, okay? Or you don't see all the anti-cancer drugs being developed at the faster rate. Now, there are reasons for that. Why it is difficult to produce a cancer drug or cancer chemotherapy, then produce an antibiotic or other drug. So what are reasons for that? See, I told you earlier also, cancer cell actually is like a normal body cell only. Okay, that means what? There is no qualitative difference, right? There is no qualitative difference. There is only quantitative difference, right? See, if you compare between bacteria and normal human cell, there are qualitative difference. That means if you take an antibacterial drug that goes inside the body, it can selectively identify the bacteria and kill the bacteria. That concept is called what? Magic bullet concept, right? So, okay, so that concept is called magic bullet concept, right? That means antibacterial drug, when it is taken, it goes inside the body, and it kills the bacteria, right? Now, in case of anti-cancer drug, when you take an anti-cancer drug, it goes inside the body. Now, normal body cell and cancer cell is same. Only difference is what? Cancer cell is going at the higher rate. But qualitatively, that means cell organelles are same. So it is very difficult to selectively target the cancer cell because normal cell are also going to be affected. And that is why it is very difficult to develop an anti-cancer drug as compared to development of antiviral, antifungal or antibacterial drug. Now, normal cancer drugs, they also affect they also kill the normal cells. That is why they are responsible for severe toxicity of the rapidly multiplying cells. So which are these rapidly multiplying cells in body? Cells of skin, cells of GI tract. These are the rapidly multiplying cells. That is why most of the anti-cancer drugs, they have side effects of GI tract and side effects of skin. Now, next is no immune mechanism, right? See, to eradicate bacteria from the body, there is immune mechanism plays the role. That means immune mechanism kills the bacteria. But in case of cancer cell, immune mechanism cannot play any role because immune system is activated or immune system kills only when it is xenobiotic. It does not kill when the cell is within the body. And as cancer cell is a part of body, immune mechanism will not play any role to kill the cancer cell. So those are the reasons why cancer cell or cancer chemotherapy is difficult normally than the other therapies. Okay. So next is cell cycle. Now, before we go to the drugs, cell cycle. So there are 4 phases actually: G1, G2, M phase, and S phase. Okay. So S phase is synthesis phase, in which all the enzymes and hormones required for the cell growth are synthesized. and M is mitosis. And G1 and G2 are the gap phases in which all this synthesis is done. That is proteins and enzymes required for the cell cycle, cell multiplication, and cell growth. Okay, we'll go to the next part, that is overview of carcinogenesis. That means how the cancer actually generated in the body, right? I told you there is mutation that may be because of inherited mutation in genes, that is because of during DNA repair or apoptosis, or this mutation can be because of environmental factors like chemicals, radiations, or viruses, right? And that results in DNA damage. When DNA damage, sometimes it is repaired, but if the DNA repair fails, it results in mutation in the cell. And that mutation causes activation of oncogenes, or it causes inactivation of tumor suppressor gene. Okay, either activation of oncogenes or inactivation of tumor suppressor gene, both results in alteration in the gene, which results in the production of tumor, or that is malignant tumor. So that is how there is generation of cancer in the body. So we'll begin with the cancer chemotherapy, that is the actual drugs now. So normally it is considered that any cancer chemotherapy, it should be cell specific or tissue specific at least. But it is very difficult. Any anti-cancer drug that is normally taken, it will kill normal cells also to some extent. So it will have some toxic effects of GI tract, skin, or alopecia, etc. And most of the anti-cancer drugs, they are taken in combination because it is very difficult to treat a cancer by single drug, because there is development of resistance. Also, cancer chemotherapy is given in combination with surgery or radiotherapy. That means first surgery is done and then it is followed by chemotherapy. Or first surgery is done, then it will be followed by radiotherapy. Depending on that, combination can be used. Okay, so next is now we come to actually your syllabus part now. So if you look at anti-cancer drugs and their classifications, they can be classified based on the mechanism of action also, and they can be classified based on the chemical structure also. Okay, so based on mechanism, it's nucleic acid synthesis inhibitors, or drugs which influence the structure and function of DNA, or inhibit the RNA synthesis, or inhibit the protein synthesis. There are different. Based on the chemical structure, they are classified as given in your syllabus now. Okay, so your syllabus says these drugs can be classified into alkylating agents. There are several subclasses in alkylating agents: nitrogen mustards, nitrosoureas, alkyl sulfonates, methyl hydrazines. These are several classes of alkylating agents. Then you have antimetabolites. In that also there are 4 subclasses: folic acid antagonist, purine antagonist, pyrimidine antagonist, glutamate antagonist. See, your syllabus does not give this sub-classification. Your syllabus says only alkylating agent. But in that you have several sub-classification, and under this all these drugs are studied. Now in this seminar, we will be looking at only those drugs which you are going to study in your syllabus. So class 3 is anti-cancer antibiotics, in which also there are 4 subclasses. Class 4 is plant compounds, that is vinculculoids, taxanes, and camphothecins. Class 5 is platinum compounds, example is cisplatin. And now class 6 and class 7 are not actually part of your syllabus, but they are very much part of therapy. They are used drugs in cancer. So this is histone deacetylase inhibitors and tyrosine kinase inhibitors. So we'll begin with the first class of the drugs, that is alkylating agents. Now see, these alkylating agents were discovered in the World War actually. In the World War, there was a use of biological weapons. And when biological weapons were used, and when the autopsy or post-mortem of the soldiers which were killed, it was done, it was clear that these chemical compounds, they can kill the cell. And reason for death of person was found to be alkylation or DNA damage. And that is how these compounds were discovered. So first class of compounds are nitrogen mustards. Examples are meclorithamine, chlorambucil, cyclophosphamide, and meflan. Then you have nitrosoureas. Examples are carmustine, lomustine, and streptozocin. Then you have alkyl sulfonates. Example is busulfan, methyl hydrazines. Example is procarbazine and temozolomide. So this is classification of alkylating agents. So we'll look at the first class of compounds. Now nitrogen mustard, their toxic effects were seen in 19th century. They have powerful vesicant action like sulfur mustards. And as I told, medical examination of victim soldiers in the World War revealed that the damage was due to alkylation of the DNA. So variety of these nitrogen mustards compounds were synthesized, and some of the compounds like meclobuthamine showed selective toxicity towards cancer cell, and then these compounds were used as anti-cancer drugs. Okay. So this is the structure of nitrogen mustard. You can see there are 4 structures given actually. So this structure is the structure of nitrogen mustard. Okay. When the centrally you have nitrogen, and on the both the side you have chloroethyl groups, CH2, CH2, Cl. It is nitrogen mustard, and this R group you can have any substitution depending on the drug. Okay. So chemically nitrogen mustard, you see carefully the structure of nitrogen mustards. They are called what? They are called bis haloalkyl amines. So bis is what? Twice. Haloalkyl is chloroethyl amines. So they are bis chloroethyl amines. Chemically nitrogen mustards are bis chloroethyl amines. Bis stands for 2. The 2 chlorine atom dramatically decrease the basic strength of amine through inductive effect. And unionized molecule, so that is why this compound exists as electrophilic azidinium ring. That means it will form a tricyclic ring, which is a azidinium ring, which is responsible for anti-cancer effect. Okay. Only if the central nitrogen is replaced with oxygen, those compounds are called oxygen mustard. If it is replaced with sulfur, those compounds are called sulfur mustard. So these compounds, there are compounds like nitrogen mustard, sulfur mustards, and oxygen mustard, out of which only nitrogen mustards are used as anti-cancer agents. So this is the first compound. If you look at your syllabus, copy, this is the first compound in it, meclobuthamine. Okay, so you can see the structure and nomenclature. It is 2,2-dichloro. You see now, this is 1,2. The nomenclature will be 1,2, and this side also 1,2. So the chloro groups are present on the second carbon on both the sides. So it is 2,2-dichloro. It is 2,2-dichloro. It is 2,2-dichloro N-methyl diethylamine. It is N-methyl diethylamine. Now this compound, it is used as a powerful vesicant, and it is too toxic. That's why it is less used actually, and it is used for leukemia. This compound is used for leukemia. Okay. Now I hope this screen is visible to all. What I'm trying to do is I'm trying to explain the mechanism of action of anti-cancer drug nitrogen mustards meclobuthamine. I would like to, Minaz ma'am, can you just let me know whether the structures are visible? Or any one of you?
Yes, sir. Is it visible?
Okay. Thank you, ma'am. Okay, so now I want all of you to see carefully the structure. Now, normally in medicinal chemistry, see, in pharmacology, you study mechanism of action, but in medicinal chemistry, you study mechanism of action along with the structures and reactions. Okay, so now you look, this is the structure of meclobuthamine, right? And we will look at now how meclobuthamine kills the cancer cell, right? So I will go back to the previous slide for further one more explanation. Now, if you look at this structure, okay, now in the meclobuthamine, you look at this structure. Now on this nitrogen, on the central nitrogen, you have a lone pair of electrons, right? And you can see now there is a chloro group here. So it is NCH2, CH2, Cl on one side, and another side also it is NCH2, CH2, Cl. Now what happens? This chloro group which is present here is electronegative, right? And because of that inductive effect, it will pull. Now see, this chloro group is connected to this carbon, right? So this bond between this carbon and this chloro group, whatever pair of electron is involved in that bond, that pair of electron will be pulled towards chloro group, or that pair of electron will be pulled towards this chlorine. Okay. So what will be the result of that? This chlorine will develop a partial negative charge, right? And at the same time, this carbon, now this carbon is a beta carbon. Why it is a beta carbon? Any carbon near the functional group is called as alpha carbon, right? So now our functional group is this amino group. So a carbon near to this amino group is alpha carbon, and the another carbon, the adjacent carbon is called always beta carbon, or it is 1 and 2, or it is alpha and beta. So what happens? This beta carbon is develops a partial positive charge, right? Because of electronegative or electron withdrawing effect of this chlorogroup. So you can imagine the structure now. This structure has a lone pair of electron on this nitrogen here, and you have a partial positive charge on this beta carbon. Beta carbon is carbon which is connected to a chlorogroup. So I'll go back to the structure now. Okay, in this now you can see now. So what happens as this beta carbon? Now this is the same structure of meclorithamine. As the beta carbon has a partial positive charge, the lone pair of electron present on the nitrogen, the lone pair of electron present on this nitrogen will attack this beta carbon. Now why that attack is possible? Because this carbon has partial positive charge and lone pair of electron on the nitrogen has negative charge, right? So this lone pair of electron present on the nitrogen will attack on this carbon and it will force this chloro group to leave. It will force this chloro group to leave, right? Because chloro group is good leaving group, it will leave. And as the attack is between the lone pair of electron on the nitrogen and the positive charge on the carbon, there will be bond formation between this nitrogen and this carbon. Okay, there will be bond formation between this nitrogen and this carbon. And you can see in the next structure, there is a bond formation between the nitrogen and carbon. Okay, nitrogen and carbon. And as this nitrogen have an additional bond now, see normally the nitrogen has 3 bonds and the 4th one is actually a lone pair of electron. Now here that lone pair of electron is involved in the bond formation. That is why that nitrogen takes up the positive charge, or that nitrogen is having the positive charge, right? So what happens? It is a highly unstable structure. That is why it is shown in the bracket. And this is called azidinium ring. This is called azidinium ring, right? So what happens? This azidinium ring is highly reactive. As the structure indicates, this azidinium ring is highly reactive, right? So what happens now? This is so whenever you take meclorithamine in the body, it goes in the body and it will form this azidinium ring, right? It will form this type of azidinium ring. Now you consider a DNA of a cancer cell. Okay, it will have now the DNA of cancer cell is made up of adenine and guanine, right? Adenine and guanine. So this is structure of guanine of the DNA of cancer cell, right? This is structure of this is structure of guanine of the DNA of the cancer cell. So you can see here it is DNA and this is guanine. So this N7 nitrogen of guanine, again there is a lone pair of electron. And now this azidinium ring is highly electrophilic. This azidinium ring is highly electrophilic, right? So what happens? This pair of electron, now there is a reaction between the drug and biomolecule or cancer cell. So lone pair of electron on this nitrogen will attack this azidinium ring. Will attack this azidinium ring. And you can see in the next structure now, there is a formation of covalent bond between the beta carbon and nitrogen or N7 of guanine. And it gets covalently bound. It gets covalently bound. So this is called alkylation actually. That is why these drugs are called. That is why these compounds are called alkylating agent, because they alkylate the DNA, right? So now what happens? See, our drug has 2 sides. On this side there is chloroethyl, and on this side also there is chloroethyl. Now whatever reaction took place on this side, same reaction can take place on the another arm also. Same way, this carbon will be electropositive. This lone pair of electron will attack on this beta carbon. This chlorine will leave, and this will attack on the another DNA, another guanine of another DNA. So that is how you see now these two guanines are connected to our drug, and that is how the alkylation or DNA damage takes place. And after the DNA damage, it results in death of cancer cell. It results in death of cancer cell. So I hope this mechanism is clear. If anybody is having any question related to this, you can ask. So we'll go to the next drug now, that is cyclophosphamide. So first compound was meclorithamine. The second compound is cyclophosphamide. So you can see the cyclophosphamide. See now that chloroethyl amino, that part is common. Okay, just you can see that there is 132 oxazophosphorin ring. Okay, this is cyclophosphamide, and it is prodrug which is metabolized to phosphoramide mustard. It is prodrug which is metabolized to phosphoramide mustard. It contains oxazophosphorin ring. It contains oxazophosphorin ring. It is used for ovarian adenocarcinoma, breast cancer, and multiple myeloma. So the nomenclature we look at is, it is, see, you look at this structure, it is NN-bis. NN-bis means on this nitrogen you have this bis 2-chloroethyl substitution, bis 2-chloroethyl substitution. Tetrahydro, because the ring is saturated, tetrahydro 2H132. 132 indicates the position of oxygen, phosphorus and nitrogen. So 132 oxides of phosphorine, 2-amine, 2 oxides of phosphorine, 2-amine, 2 oxide. So that is nomenclature for, that is chemical nomenclature or IUPAC nomenclature for this compound. So that is cyclophosphamide. It is used for ovarian adenocarcinoma, breast cancer and multiple myeloma. Now look at this. This is mechanism. This is mechanism for cyclophosphamide. Now cyclophosphamide, you have seen the structure. This is structure of cyclophosphamide. Okay. When it goes in the body, it is hydroxylated. When it goes in the body, it is hydroxylated. You can see this hydroxy group gets attached, 4-hydroxy cyclophosphamide. Then this bond is hydrolyzed and it gives aldophosphamide. It gives aldophosphamide. So after hydrolysis, this becomes aldehyde. You can see it is CHO. Okay, and then after removal of this, as with the non-enzymatic pathway, this portion, okay, this portion is removed as acrolein. You can see CHO, CH2, CHO. This portion is removed as acrolein, and this portion is removed as phosphoric acid, and you get this phosphoramide mustard. So now this compound is very, very similar to the structure of meclorethamine, and in the same way now it will become what this. So you can see it becomes bischloroethylamine. And in the same way now, lone pair of electron will attack the beta carbon. You will get the azidinium ring, and that azidinium ring will attack the N7 of guanine. So same mechanism like we have seen for the previous compound. So that is mechanism of action for cyclophosphamide. Now compared to meclorethamine, cyclophosphamide is a safer drug and is more used, and it is having selectivity. So that is compared to meclorethamine, it is used more. Okay, that is the next drug in your syllabus, that is chlorambucil, right? So you can see now the structure of chlorambucil. So the difference between the first compound is there was an alkyl group here, that is methyl, simple methyl group. Okay, you can see this is structure of meclorethamine. In meclorethamine, you have a simple methyl group here. Okay, in cyclophosphamide, you have oxides of phosphorine ring here. Whereas in chlorambucil, you have carboxylic acid. You have a carboxylic acid with aromatic ring. Carboxylic acid with aromatic ring. So nomenclature is para di2-chloroethyl aminophenyl butyric acid or 4,4-bis 2-chloroethyl aminophenyl butanoic acid. So for any drug, you can give nomenclatures in the different way, either butanoic acid or butyric acid. It is an aromatic nitrogen mustard with higher selectivity. That means it has more selectivity. It has more selectivity to the cancer cell and as compared to meclorethamine. And more selectivity is because of the aromatic ring. We'll see the reason for that, why aromatic ring gives more selectivity for these compounds. Uses are lymphosarcoma and chronic leukocytic leukemia. Next is chlorambucil metabolism. So it gets metabolized with the oxidative decarboxylation. You see these carbons are reduced and you get phenyl acetic acid mustard, which is an active metabolite. Okay, so that is metabolism for chlorambucil. Chlorambucil produces its anticancer effect by interfering with DNA replication and damaging the DNA in a cell. The DNA damage induces cell cycle arrest and causes cellular apoptosis. It causes cellular apoptosis. So that is mechanism of action for chlorambucil. Next drug is methylene. Again, it is an example of aromatic. Now you see, first drug it contained only methyl group here. Second, it contained oxides of phosphorine ring here. Third contained aromatic ring and carboxylic group. And now fourth contains aromatic ring, carboxylic group, and amino group also. So that is how the changes in the structure are affecting the selectivity towards cancer cell. Nomenclature is 4-bis 2-chloroethyl amino L-phenylalanine. 4-bis 2-chloroethyl amino L-phenylalanine. Now it is an aryl substituted nitrogen mustard with higher selectivity, and it is used in multiple myeloma, ovarian cancer, and breast cancer. Okay. Next is methylene metabolism. Methylene undergoes metabolic activation and is inactivated in plasma primarily by non-enzymatic hydrolysis to monohydroxymethylene and dihydroxymethylene. Okay, so you can see here the fluoro groups are replaced with hydroxy groups. Those fluoro groups are metabolized and replaced by hydroxy group, and that is metabolism. So either monohydroxymethylene or dihydroxymethylene. So mechanism of action for methylene. Methylene chemically alters the DNA nucleotide guanine through alkylation. It causes linkages between the strands of DNA. That means it will alkylate the DNA, same way we have seen for macromolecules, right? And it will cause linkage between the two DNA strands. Okay, it will form a covalent bond with the DNA N7 guanine of the DNA. Okay, exact position of the bond is what? It forms the bond with N7 guanine of the DNA between the two strands, and that is how it will cause the DNA damage. This chemical alteration inhibits DNA synthesis, RNA synthesis, and functions necessary for cells to survive. And that is how it results in anti-cancer effect. Okay. Next is SAR of nitrogen mustards. So we have seen now 4 compounds in this category: meclorithamine, chlorambucil, methylene, and cyclophosphamide. And you see this portion is common to all, bis-chloroethylamine. What is difference is this R group. So R group can be alkyl, or that is aliphatic or aromatic, right? Now this R group, that means for compound to be active, this R group can be alkyl or aromatic. Now the two chloro groups decrease basicity of amines and favors the formation of azonium ring. That is why these two chloro groups are required. These two chloro groups, because of that, this lone pair of electron can be easily donated, and this compound will form the azonium ion in body, which is required for anti-cancer effect. Then R group is a prime determinant of chemical reactivity, oral bioavailability, and side effects. That means in all these drugs, this R group will determine chemical reactivity, oral bioavailability, and side effects. If R is methyl group, it will push electron towards amine, enhancing nucleophilic character of lone pair of electron. So now there are two cases. See, this R group can be either methyl or it can be phenyl ring, like aromatic. So if this R group is methyl, it is electron donor, right? So it will push electron density towards nitrogen, and that formation of azonium ring will be very, very faster. Because if electron pair is pulled towards nitrogen, the donation of that electron will, that attack by this lone pair of electron on this beta carbon will also be faster. But if there is aromatic ring here at the R place, the lone pair of electron will be in resonance. The lone pair of electron will be in resonance. And that is why attack will be slower and selective. That is why if R group is aromatic, those compounds are selective and better, like chlorambucil and methylene. Whereas if R group is methyl group, like in meclorithamine, those compounds are non-selective and more toxic. That is why methylene and chlorambucil are more preferred or more used. So that was all about SAR of nitrogen mustards. So we'll go to the next class now in your alkali agents. We have seen in alkali agent there are different subclasses. So alkali agent next class is alkyl sulfonates. Example of that is busulfan. So you can see alkyl sulfonates are nothing but esters of alkene sulfonic acid. See, normal ester is what? RCOOR dash, right? So here it is RSO3H. So what is sulfonic acid? RSO3H. So this H is also replaced with another alkyl group that gives ester of alkane sulfonic acid. Ester of alkane sulfonic acid. It is a cell cycle non-specific drugs. That means it can act on any phase of cell cycle. Busulfan is a bifunctional alkylating agent having a selective immunosuppressive effect on bone marrow. Okay, so we'll see the structure of busulfan. This is structure of busulfan. So you can see the nomenclature now. 1,4-dimethane sulfonyl oxybutane. 1,4-dimethane Hello, sir. Am I audible?
Yes, sir.
Okay. So this is mechanism of action for busulfan. You can see the structure very carefully. This carbon, which is just next to your oxygen, will develop a partial positive charge because of higher electronegativity of oxygen. So what happens now? Again, same you see. This is N7 of guanine of DNA. So,
Sir, sorry to interact, but screen is not visible.
okay, just a minute. Is it visible now?
Yes, sir.
Okay. So if you look at this structure now, there is a development of partial positive charge, and that positive charge will be attacked by the lone pair of electron present on N7 of guanine. Same like we have seen in case of macromolecules. So this one side of busulfan will get attached to guanine of the DNA. So on the second side, again the same reaction will be repeated, and you will get the same structure. I will try to show you that previous mechanism. So from that you will. Yeah, in this way, you can see there are these two guanines of two DNA, and in between there is your macromolecules, the drug. In the same way here, now there will be two guanines of two DNA, and in between there will be your busulfan. Okay, so both the drugs have similar mechanism of action. Only it can result in now intra-strand cross-link and inter-strand cross-link. What is that? That means if it inhibits intra-strand is what? N7 guanine of the same and N3 adenine of the same DNA. Okay, that means one side of the drug will bind to N7 guanine of the DNA, and other side of the same drug will bind to N3 of the adenine, which will result in intra-strand cross-link. And if one side of the drug is bound to N7 of the guanine of one DNA, and another side of the drug is bound to N7 guanine of the another DNA, it will result in inter-strand cross-link. Intra means on the same DNA, inter-strand cross-link means on the two different DNAs. Same drug is bound on two different DNAs. So that is mechanism of action for busulfan. Same thing, same reaction is shown, how it is attacked, how that busulfan is attacked by N7 of guanine, how that sulfonate leaves, and DNA guanine gets attacked on the one side of drug, then same reaction will take place on the another side, and this is the reaction. You see, the two guanines are connected, and in between there is a drug. Now, metabolism. Busulfan is extensively metabolized in the hepatic system, that is in liver. It is primarily metabolized by conjugation with glutathione. 12 inactive metabolites are reported, and these are some structures of metabolite: tetrahydrothiophene and sulfolate. So these are metabolites which are formed after metabolism of busulfan. Okay, so with that we have finished with the first class, which was alkylating agents. They caused alkylation of the DNA, and that is how they caused anti-cancer effect, or they kill the cancer cell. Now the next category of drug are antimetabolites. So what are they? Antimetabolites are antagonists of normal metabolism or normal metabolites, right? So there are some normal components. These are compounds which are very closely related to normal components which are required in DNA synthesis. So which are the components which are required in DNA synthesis? Adenine, guanine, thymine, cytosine, uracil, etc. Right? These are metabolites. And small change in these compounds will give antimetabolites or anti-cancer drugs. Okay? They competitively inhibit the utilization of normal substrate and get themselves incorporated, forming dysfunctional macromolecules. Okay? Antimetabolites are Sphase-specific drugs, and they stop denovo DNA synthesis by inhibiting formation of nucleotide. What is nucleotide means what? Nitrogen base plus sugar plus phosphate group. So what is example of nitrogen base? Adenine and guanine is an example of nitrogen base. Okay. So when on nitrogen base you have sugar, that is ribose, it is called nucleoside. And when you have phosphate group also, it is called nucleotide. So example of nucleotide is what? Adenosine monophosphate or guanosine monophosphate. So this is classification of antimetabolites. Antimetabolites are compounds are folate antagonist. Example is methotrexate and pralatrexate. Then you have purine antagonist. Example is 6-mercaptopurine and 6-thiogonine. Then you have pyrimidine antagonist. There are 3 classes again in that, and the last one is serine antagonist. So these are all classification, and there are one or two drugs in each class. So we'll begin with the first class now. That is antimetabolite. First class in antimetabolites is folate antagonist. An example is methotrexate. Okay. So what this compound do? See, folate antagonist, they are required for the synthesis of DNA as a cofactor. So if folate antagonist, if folate antagonist is taken, it will result in the faulty synthesis of cofactor or inhibition of the DNA synthesis. Okay. This is the chemical nomenclature of the compound. It is glutamic acid actually. Chemically, it is glutamic acid. They are direct inhibitor of thymidylate synthesis. Okay, and they are used in acute lymphoblastic leukemia and lung cancer. Okay, so this is normal structure of folic acid, and very small change in this structure, even just to replace this ketone or double bond O with amino group, and you get the structure of methotrexate. Now, these are different types of folic acid cofactors: folic acid, dihydrofolic acid, tetrahydrofolic acid, and N5-N10-methylene tetrahydrofolic acid. So these are different types of folic acid cofactors. So this is how the folate cofactors act. See, this is your deoxyuridine monophosphate, okay, which is a nucleotide, and it is converted to DTMP, that is deoxythymidine monophosphate. This deoxythymidine monophosphate is required for DNA synthesis. And see, what is difference between this deoxyuridine monophosphate and this DTMP monophosphate is only this methyl group. Okay, you can see in the structure X. In deoxyuridine monophosphate, it is X, or it is hydrogen, and in deoxythymidine monophosphate, it is methyl group. So from where this methyl group comes, it is donated by this cofactor, that is N5-N10-methylene tetrahydrofolic acid. So this methyl group gets attached here at the place of X. So if there is no cofactor, this methyl group will not be available, and it will stop the synthesis of DTMP. And that is how this compound acts as anti-cancer agent or anti-cancer compound. Next class is, so first class was folate antagonist, second is purine antagonist, right? So these are drugs which are structurally similar to purine nucleotides. Okay. Examples are 6-mercaptopurine and 6-thioguanine. Okay, so this is structure of 6-mercaptopurine, and this is normal structure of thioguanine. This is mercaptopurine. Okay, this is normal structure of adenine. This is structure of 6-mercaptopurine. This is structure of guanine, and this is structure of thioguanine. So these are the two drugs, 6-mercaptopurine and 6-thioguanine, and these two are their normal metabolites, and these are antimetabolites. So this is mechanism. Now normally they are involved in the synthesis of DNA, right? So I told you this, what happens instead of normal metabolite, these antimetabolites are taken up and they inhibit the synthesis of this compound. See, normally what is to be synthesized for synthesis of DNA? Deoxyguanosine triphosphate, right? But this thio group is present additional in our drug. That is why that will come in the final compound. So instead of synthesizing deoxyguanosine triphosphate, that is DGTP, it will synthesize what? Thio-DGTP. And this thio-DGTP will get incorporated into DNA, and it will result in DNA damage, which will result in cell death. DNA damage that will result in cell death. Okay, so that is how this drug acts as anti-cancer compound, or it gives anti-cancer effect. Okay, so next class is now in antimetabolites we have seen first class was folate antagonist, second class was purine antagonist, and third one is pyrimidine antagonist. Okay, so in pyrimidine antagonist, first example is 5-fluorouracil. Okay, you can see this is structure of uracil. Only addition of 5-fluoro group gives 5-fluorouracil. So the mechanism is again same like folate antagonist. It inhibits the DTMP synthesis. Okay, 5-fluorouracil inhibits the DTMP synthesis, which is required for DNA synthesis. So all the antimetabolites, they inhibit de novo DNA synthesis, and if they inhibit DNA synthesis, ultimately it will result in DNA damage and death of a cancer cell. Death of cancer cell. So this is mechanism for 5-fluorouracil. Okay, so with that we have finished class 1 and class 2. Class 1 was alkylating agent and class 2 was antimetabolites. I am not covering all the drugs which are given in your syllabus because it will take little longer time. So I am taking 1 or 2 examples from each class. Okay, so next class is anti-cancer antibiotics. Okay, these are the products obtained from microorganisms and have prominent anti-tumor activity. These are compounds which were rejected as antibacterials due to their toxicity, and hence they were rediscovered as anti-cancer agents. Practically all of them are called intercalating agents. What are intercalation? Between the two DNA strands, drug gets intercalated or sandwiched. That is why they are called as DNA intercalating agents. So this is the classification. You have 4 drugs: actinomycin, doxorubicin, bleomycin, and mitomycin. All 4 are from different chemical classes. So the first example and the first class is dactinomycins, and example is actinomycin. It is obtained from Streptomyces paravalis. That is, it is natural compound. Okay. So you have this phenoxygen ring. Okay. This ring is called phenoxygen ring, which is connected to 2 pentapeptide lactones. So this is a natural compound antibiotic. That is why it has a big structure. And normally, from exam point of view, nomenclature for such a big compounds is not asked. Okay. Normally, what is asked is chemical features. So in chemical features, you can say it contains this long phenoxygen ring. Okay, it contains phenoxygen ring. It contains this pentapeptide lactone. Pentapeptide lactone because you can see it is a lactone. There is a bond oxygen, and it contains 5 amino acids: L-threonine, D-valine, L-proline, sarcosine, and L-methylvaline. That is why it is called pentapeptide lactone. So this phenoxygen ring is connected to 2 pentapeptide lactone, and that gives actinomycin D or dactinomycin. Okay, and this is mechanism. As I told you, see, there is an enzyme called DNA kyrase. You all must have heard. What is the role of DNA kyrase enzyme? To cause unwinding of DNA, which results in cut out to the DNA at specific site, assessing the DNA genetic material, and again resealing. So for that, assessing the genetic material of the DNA, there is what is essential: unwinding, right? And for that unwinding, there should be DNA intercalation. So this drug, it gets intercalated between 2 DNA strands, and it inhibits the unwinding and action of DNA kyrase. And that is how it will result in cell death. That is how it results in cell death. Okay, so that was first class of drugs, that is actinomycins or dactinomycin. Then the next class is anthracyclinones. Anthracyclinones are nothing but anthraquinone glycosides. Okay, you can see the structure. They contain this tetracyclic ring, and it contains a glycoside or sugar. That is why they are called glycosides or anthraquinone glycosides. This is the first compound, and its name is doxorubicin. So they are very similar. Their structure is similar to tetracycline antibiotics, but they contain an additional sugar. They contain an additional sugar. This is structure of doxorubicin. So mechanism is again same. Drug gets intercalated between the 2 DNA strands. Drug gets intercalated between 2 DNA strands, and that is how it inhibits the enzyme DNA kyrase, or it causes DNA damage and results in cell death and gives anti-cancer effect. So with that, we have finished class 3, that is anti-cancer antibiotics. So in anti-cancer antibiotics, we have seen how many drugs? 3. Okay, first one is actinomycin D, second is doxorubicin, and third one is, okay, we have seen only 2 drugs. Third one is not in your syllabus. Third compound is mitotane, which is an miscellaneous antibiotic. So we'll go to the next class 4, that is plant compounds. Okay, that means these are the anti-cancer compounds which are obtained from plants. So the two classes are vinculculoids and podophylletoxin, that is etoposide. Examples of vinculculoids are vincristine and vinblastine. So we'll start with vinculculoids first. These compounds are obtained from the Cathananthus roseus. Okay, in Marathi we call it sadafuli, right? And they are chemically there are 2 compounds, vincristine and vinblastine. It contains 2 rings. Indole containing portion is called catharanthine, and indoline containing portion is called vindoline. You can see the structure. Structure is too big. This is the structure of vinculculoids. This is structure of vinculculoid. So this portion is called indoline, and this structure is called catharanthine. Okay, so one is catharanthine portion, and other is indoline portion. You can see there is an indole ring. That's why it is also called as indole alkaloids. There are several asymmetric carbons in this compound, and that stereochemistry is very, very important. This compound cannot be synthesized in lab, and it is obtained from the vinca plant. Okay, that is Catharanthus roseus. So mechanism of action for vinculcloids. Now these compounds, plant compounds, are normally mitotic spindle inhibitor. In any cell, mitotic spindle is required for cell division. And these vinculcloids, they bind to mitotic spindle and cause dissolution of mitotic spindle. They dissolve the mitotic spindle. So mitotic spindle is not available for cell division. And that is how this compound prevents the cell division, and it gives the anti-cancer effect. So diagrammatically it is shown how these compounds, they bind to mitotic spindle and they result in inhibition of mitotic cell division or dissolution of mitotic spindle, which results in death of a cancer cell. Yeah. So this is mitotic spindle. It is continuously polymerized and depolymerized, right? So when it gets polymerized and depolymerized, along with that, a genetic material is divided, septum formation takes place, and cell is divided in two. But when vinculcloids bind to it, it is not able to divide the genetic material, or it results in inhibition of cell division. So you can say all these plant compounds, they are mitotic spindle poison or inhibitors of cell division. Okay, so with that we are finished with the plant compounds. In plant compound, as far as your syllabus is considered, there are only vinca alkaloids. There are other compounds in this class, but we are not going to cover those compounds because they are not related to your syllabus. Okay, so next class is now platinum compounds. Example is cisplatin. Now platinum compounds were discovered accidentally, actually. Means it was observed that when the solution which contains a platinum electrode was left accidentally for so many days, the bacteria which grown in that were abnormal, and reason for that was what? The platinum complex was formed from that platinum electrode, and that observation led to synthesis of so many platinum complexes, and they were studied for their anti-cancer effect. And cisplatin was the compound which was found to have good activity. That's why it was used as anti-cancer agent. So its nomenclature is cis-dichlorodiamine platinum. Cis-dichlorodiamine platinum. It is used for metastatic testicular cancer. So platinum compounds, their mechanism, when they go in the body, they are hydrolyzed. You can see here now, these amino groups, they are hydrolyzed and water molecules get attached. So they are called as hydrated cisplatin. And then this cisplatin or this platinum is actually acts as a magnet because it is electron deficient, and it will attack the DNA. And it will get bound to DNA. And its mechanism is similar to alkylating agent. It will alkylate the DNA. Okay, another compound in your syllabus is metotane. It is in the miscellaneous compound, and its nomenclature, you can see the structure. It is 1-chloro, 2,2-dichloro, 1,4-chlorophenyl ethyl benzene. This is nomenclature for the compound. It acts on a steroidal mechanism. It inhibits steroidogenesis and cytostatic and anti-neoplastic medication. It is used for adenocortical carcinoma and Cushing syndrome. So this comes in the miscellaneous compound metotane. Okay, so we have tried to cover almost all the classes that are given in your syllabus, and I have tried and covered almost all the drugs. There are some drugs which are not covered, but they are similar drugs what we have seen. Now we'll go to the conclusion. Now see, whatever drugs we have seen, all the drugs we have seen based on your syllabus. These are the basic anti-cancer compounds or anti-neoplastic agents which are given in your syllabus. And if you see, they are diverse chemical compounds. They are from the different chemical classes. They are from alkylating agents. They are antimetabolites. They are anti-cancer antibiotics. Then you have a plant compounds, that is vinculcloids. Then topotecans, etoposides. There are so many compounds. Alkylating agents, they alkylate and kill the cancer cell. Antimetabolites, they inhibit the DNA synthesis and kill the cancer cell. Plant compounds or vinculcloids, they are mitotic spindle poison. Then anti-cancer antibiotics, they are DNA intercalators. That means they intercalate between the two DNA strands, and then they inhibit they damage the DNA. So all these compounds are having diverse chemical structures and different mode of actions. Okay, and in any anti-cancer therapy, there should be combination therapy to avoid the toxicity. Okay. Now, whatever drugs we have covered or whatever drugs we have studied till now, they were basic compounds which are given in your syllabus. But there are so many newer approaches in the or newer drugs which are used for cancer. One of those class is tyrosine kinase inhibitors. One of the very prominent example from that class is imatinib, which is used for blood cancer. So there are so many drugs in this class available. Imatinib, dasatinib, lapatinib. All these are the newer drugs which are very widely used for cancer, especially blood cancer. Then we have other classes of drugs like matrix metalloproteinase inhibitors, proteasome inhibitors. Nowadays, there are only, even though some monoclonal antibodies are specifically targeted for cancer and they are used for the cancer. So basically, what we have studied is we have tried to study the structure of the drugs which are given in your syllabus, their nomenclature, their metabolism, along with the metabolic activation and mechanism, SAR for some classes of drug, and their uses. But there are so many drugs to be covered. There are so many recent advances in the cancer. As just discussed, newer classes are tyrosine kinase inhibitor, matrix metalloproteinase inhibitor, and proteasome inhibitors. And some monoclonal antibodies are also used for cancer. So I hope this will cover the objective of the syllabus, which we have seen initially. Okay, what you said, students should know the structures of drug. So you all will have to practice these drugs. Okay, with this 1 hour seminar, you will not be able to remember the structures. Okay, so you should be able to identify the drug from its structure. You should be able to classify the anti-cancer compound. You should be able to tell mechanism of action for the drug. You should be able to highlight or discuss the SAR of the compound. That means how the activity changes with the change in the structure. You should be able to tell the use of compound. You should know what are combination therapy, what are recent advances in cancer, and what are adverse effects of these anti-cancer drugs. Okay, so that is conclusion from my side. So at the conclusion, I would like to acknowledge, I would like to thank management of Samartha Group of Institution, Belhe, Junnar, District Pune, for providing me this opportunity to deliver a talk to the students. I would like to also thank Principal Dr. Santosh Gulle, Samartha College of Pharmacy and Samartha Institute of Pharmacy, Belhe, Junnar. I would like to also thank Head of Department and Minaz ma'am and all the faculty from Samartha College of Pharmacy and Samartha Institute of Pharmacy for listening patiently and coordinating this seminar. And finally, I would like to thank all the students who have joined this meeting. I think there are around 95 to 100 students who are there initially. So around 80 to 100 students for their patient listening and giving me opportunity to share my knowledge with you. Thank you once again. Thanks a lot. That's all from my side. I request Minaz ma'am to take over and conclude the session.
Yes, sir. Any questions from participants?
Yes, ma'am.
Please.
Sir, what is difference between apoptosis and necrosis?
Yeah, actually, these are the simple terminologies that we study in biochemistry. See, I gave example of natural death and accidental death. See, when any person dies on the road accident, what we call accidental death, right? And if the person dies at the age of 90 because of age, that is a natural death. In the same way, whenever there is any cell in the body, it is supposed to die normally, right? Like RBC has a lifespan of 120 days. So any RBC, when it is produced, after 120 days, it will die normally or naturally. That death is called apoptosis. But suppose there is any infection in body or there is inflammation, that RBC will die before 120 days because of that infection or inflammation. That is called necrosis. Okay, that death is because of injury or inflammation. That is called necrosis. Whenever death is natural, that is called apoptosis. I hope it is clear.
Yes, sir.
Any more questions?
And sir, why nitrogen mustard is used as anti-cancer?
Okay, see, nitrogen mustard, the property, I will go back to that slide and I will show you the slide. If you look at the nitrogen mustard, their structure, okay, you look at this structure, yeah. This is the structure of nitrogen mustard. If you look at this structure, these structures are highly reactive. That means when they go in the body, the lone pair of electron will attack on that beta carbon and very fast it forms that azarinium ring. Okay, that azarinium ring is highly reactive and it can attack the, now if you see here there is only methyl group, but if there is aromatic ring here, that structure can be selectively targeted to cancer cell. That means this compound can alkylate the cancer cell. That means what? It can bind to DNA of the cancer cell and it can damage the DNA. And when DNA is damaged, that cell cannot grow. And what is our purpose? We want to kill the cancer cell. So same thing will happen if anti-alkylating agents are taken. That is why these alkylating agents are used as anti-cancer agents. They will alkylate the cancer cell. That means they will alkylate the DNA. In short, they will kill the cancer cell actually, because that alkylation is causing DNA damage. Alkylation is nothing but formation of alkyl bond or covalent bond. That formation of covalent bond will cause the DNA damage and kill the cancer cell. I hope it is clear.
Okay, thanks, sir.
Yeah.
So I assume no any question from audience.
Okay.
Now this time to vote of thanks. Honorable Principal Sir, Speaker, Dr. Bharat Doksawe Sir, all faculty members and participants. It's my privilege to have been asked a purpose of vote of thanks on this occasion. I, on behalf of Samartha Rural Campus, Samartha Management, Samartha College and Institute of Pharmacy, and the volunteer, extend a very hearty vote of thanks to Dr. Bharat Doksawe Sir for valuable guidance, for making this webinar very meaningful and interesting. Also, I would like to extend a special thanks to Samartha Rural Campus and Samartha Management for giving us an opportunity to organize this event. I would like to thank honorable faculty members and delegates who blessed with us presence and took out a valuable time on our busy schedule. I heartily congratulate to all participants for their active participation in this event. Thank you guys for making this event successfully with their contribution. Thank you, sir.
Thank you, ma'am. Thank you, ma'am. Can I log out session?
Yes, sir.
Okay. Thank you, ma'am. हाँ सर बोला ना. हाँ अच्छा पण झालं होतं म्हणजे वोट ऑफ थँक्स वगैरे झालं होतं. ओके ओके पण म्हणजे पूर्ण सेशन नाही ऐकत तुम्हाला. ओके ओके काय प्रॉब्लेम नाही. ओके सर ओके. हां